welcome back. So in this video we will discuss the CNS chapter from Pediatrics, and we will discuss each topics one by one. The important topics will be discussed in this video. So the first topic that we will be discussing is pyogenic meningitis. First we will discuss the scenario and then the important investigations and treatment options and management options. So we are having a scenario that there is a 5-year-old child present with history of fever, headache and vomiting for 3 days. On examination, he is ill looking with running temperature of 103 degree Fahrenheit and having stiffness of neck. On flexing neck, child flexes both knee joints. Another scenario is that there is a 1-year-old boy developed high-grade fever, vomiting and poor feeding. 2 days later, he developed generalized toxiclonic fits which lasted for more than 10 minutes. After that, the infant remained drowsy. He is still febrile and tense and having anterior bulging fontanelle. So what are the diagnoses, the investigations, the treatment and the prevention? Another scenario is that there is an 18-year-old boy who is unwell for last 3 days and he is having high-grade fever and fits. Fits are frequent and generalized tonic. He has only received his BCG vaccine and polio drops. He is febrile, having temperature of 102 degrees C with tense and bulging anterior fontanelle. So what is the diagnosis, investigation, acute and end complications and treatment? So here we get that in the pyogenic meningitis, we are having the following features, that is fever, headache, vomiting and ill looking, fever, stiffness of neck, and on flexing neck, both knees joints are flexed. Then another is that high-grade fever, vomiting, poor feeding, and generalized tonic-clonic fits, which lasted for more than 10 minutes, and the infant remained drowsy. He is still febrile with tense bulging anterior fontanelle. So the history of bulging anterior fontanelle is also present. In this, we are having high-grade fever, fits. Fits are frequent and generalized and have received BCG and polio drops only, and he is febrile and having tense bulging anterior fontanelle. So in the pyogenic meningitis, these features are the common, that is fever and neck stiffness and anterior fontanelle is bulging anterior fontanelle. Okay, so now let's discuss the definition of pyogenic meningitis. Meningitis is defined as inflammation of the membrane surrounding the brain and spinal cord, including dura, arcanine, and pyometer. Meningoencephalitis represents inflammation of both meninges and cortex of brain. Now the causes are age, that is 0 to 2 months, E. coli, group B streptococci, and Staphylococcus aureus, Listeria monocytogenes. These are the causes of meningitis at the age of 0 to 2 months. Then from 2 months to 2 years, H. influenza type B, Streptococcus pneumonia, and Neisseria meningitis are the causes. At the age 2 years to 21 years, N meningitis, serotype A, B, C, Y, and W, and Streptococcus pneumonia. These are the serotypes. These are the types causes of pyogenic meningitis. What are the other differential diagnoses? These are TB meningitis, aseptic meningitis, brain abscess, cerebral malaria, and brain tumor. Okay, the clinical features are fever, lethargy, irritable, nausea, photopia, neck and back pain, rigidity, seizures, and bulging fontanelles. These are the common clinical features in the case of pyogenic meningitis. What investigations will we do to confirm the diagnosis? First of all, blood culture is done, that is, there will be positive result of H. influenza or S. pneumonia. Then lumbar puncture is done. Okay, so these are the normal values, and for bacterial, these values will be in this range. In the fungal or TB infection, it will be like this, and in viral, it will be like this. Okay, so in the normal value of open pressure is 10 to 20 centimeter. The color is clear. The cell type is that there is no predominance. Proteins are 20 to 40 milligram per dl are normal proteins, and glucose 48 to 80 milligram per dl, that is less than 2/3 of the blood glucose. These are the normal values. Now in bacterial, the opening pressure will be raised. Color will be opalescent to purulent, and cell type will be increased, protein will be increased, and the glucose will be decreased by half of the plasma. In fungal, the pressure is raised, the color is purulent, and the cell types are lymphocytes, and the proteins are raised, and the glucose is decreased. In viral, it is the opening pressure is whether increased or normal. The color is clear, lymphocytes are increased, proteins are increased, and the glucose level is normal. So by investigating these things, that is the glucose, the protein, the cell type, the color, and the opening pressure, we can guess that what type of organism is the cause to organism of this pyogenic bacterial meningitis. Okay, so blood counts are done. First of all, we have done the blood culture, then the lumbar puncture, then the blood counts are done. There will be leukocytosis. X-ray chest is done to rule out the pneumonia, and CT scan is done. Rapid diagnostic tests are done, that is CSF lactate is check, and immunoelectrophoresis is done. Gram staining is done to find the cause to organism. These are the major investigations that are done in the pyogenic meningitis. This is X-ray chest, this is CT scan, and this is for concurrent immunoelectrophoresis and CSF lactate. Gram staining to find cause to organism. Now the prevention is that H influenza vaccines are given, and 7-valent pneumococcal protein polysaccharide vaccines are given, plus antibiotic prophylactically can also be given. But the main thing for prevention is vaccine, that is H influenza vaccine and 7-valent pneumococcal protein polysaccharide vaccine. Now the management options. Supportive management and specific management. In supportive management, vital signs are checked, frequent neurological assessment is done, measure the head circumference and input-output record, then temperature is measured and fluid resuscitation is done, prevent aspiration and recognize the seizures. Now specifically antibiotics are given, that is empirical or ceftriaxone or ceftriaxone plus vancomycin, and group B streptococcus benzyl penicillin, and for E. coli ceftriaxone and aminoglycosides. For H influenza, ampicillin plus ceftriaxone plus ceftriaxone are given. For S pneumonia, ampicillin plus ceftriaxone or vancomycin are given. Then steroids are given, that is intravenous dexamethasone for meningitis, and elevated CSF proteins and eighth cranial nerve damage. Steroids are given for this purpose, to prevent this, the elevated CSF protein and the eighth cranial nerve damage. Okay, so these are the specific management options for the pyogenic meningitis. Okay. These are the complications, that is raised intracranial pressure, cranial nerve pulses, and seizure, stroke, ataxia, inappropriate idiot secretions, prolonged fever greater than 10 days, rapidly increasing head circumference, subdural effusions, and spastic purpurium, blindness, cerebral infarcts, anemia, cerebral herniation, epilepsy, deafness, and spasticity. These are the most common complications of the case of pyogenic meningitis. So we have discussed the first topic from CNS, that is pyogenic meningitis. Its common features, which are fever, neck stiffness, and bulging anterior fontanelle. Then we have discussed the causes at different ages, the cause to organisms. Then we have discussed the differential diagnosis, the clinical features, and the investigations, which are blood culture and lumbar puncture, blood counts, X-ray chest, CT scan, rapid diagnostic test, and gram staining. Then we have discussed the management options, which are supportive and specific. In specific, antibiotics are given. Specific organism have specific antibiotic, and then steroids are given. Then at the end, we have discussed the complications of pyogenic meningitis. Thanks for watching.